tort reform must be an integral part of any overhaul of healthcare. Will it be?
Thank you, Jim, and given that you've got 3 bills in the House and 1 bill in the Senate and, that have been passed out of committee and none of them have tort reform, I think the likelihood is pretty slim. And if we had something in the federal legislation, it would limit itself to federal court, which means that every tort case, every liability case would be brought in state court from that point forward, meaning we hadn't accomplished much, if anything. 10 states have adopted some type of tort changes, some more effective than others, but there's still 40 states that haven't. Ours is one of them. Tom Coburn's and my approach is more the carrot than it is the stick. Because if you want to bring some type of tort change, you've got to entice states to adopt changes on their own. So in the Patient's Choice Act, and that's Tom's in my bill, it was introduced in May, you can see it on my website, or you can just Google Patient's Choice Act. There have been websites created from people all around the country that have read it and see it as at least an option, if not the solution, and maybe it will be incorporated partially in whatever bill is passed. But Tom and I give states 3 options. One of them is to create a new health court where a judge only hears liability cases, and when a doctor walks in, it's a doctor, his lawyer, the patient, and their lawyer, and that's it. And the judge hears the case, determines whether somebody was injured, determines what the appropriate amount is if they were injured, and there's not a jury and they're not professional witnesses, but you've got a judge on the bench that becomes an expert at hearing liability cases, just like we've got an appellate court to hear VA disability claims. We think that's an option. Another option is to allow doctors to report voluntarily medical errors, and if they will report that voluntarily so that the public knows what their performance actually is, then we would create some type of national liability limitation, an umbrella of coverage like we do with the Uniform Code, a core of healthcare professionals that are incorporated in the federal government. Either one of these things, if a state adopted it, we would give them a 1% bonus on their Medicaid. So we're trying to come up with a creative way to bring tort changes in all 50 states, but to do it in a way that it would actually have a meaningful impact from a standpoint of federal court or state court by the states adopting it voluntarily.
Why is the Obama administration against the Honduran people, and can you do anything about it?
Against the what?
Honduran people.
Why is the president against the Honduran people? The president got some really bad advice from his White House counsel, Greg Craig, I think. It is really not difficult to read the Honduran Constitution and realize that it was actually against the Constitution for the current president to run for another term, and that it was actually prescribed in the Constitution that if somebody attempted to do that, that it was the military's responsibility to remove that person. Everything that they have done has been exactly what the Constitution in Honduras said, and I think this administration at some point will start backing up from the position that they took, because clearly the international community has called them on it.